गुड इवनिंग, नमस्ते, खुशामदीद। मैं आपकी होस्ट और दोस्त डॉक्टर विनी कांट्रू। मैं एक पल्मोनोलॉजिस्ट और क्रिटिकल केयर स्पेशलिस्ट हूँ इंद्रप्रस्थ अपोलो हॉस्पिटल्स, नई दिल्ली में। मैं आपसे थर्सडेज को मिलती हूँ। इसी टॉक शो पे एक मेडिकल टॉक शो है जिसका नाम डॉक्टर केकेज मेड टॉक्स है, और हम आपके पास नए नए टॉपिक्स लेकर आते हैं, डिस्कसिंग वेरियस एस्पेक्ट्स ऑफ द मेडिकल इश्यूज with you, taking your questions and increasing the knowledge and awareness about various medical related issues. आज के दिन भी कुछ ऐसा ही हम करने वाले हैं। एक बहुत ही इंपॉर्टेंट टॉपिक पे बात करने वाले हैं। वी आर गोइंग टू डिस्कस अबाउट द मैनेजमेंट ऑफ PCOS, which is again a very important topic, especially in young females who have been unmarried or recently married. We will talk about all these issues. And right now you're watching the 985th, yes, the mammoth 985th episode of Dr. KK's Med Talks. So let's go to the headlines of the day. According to WHO reports, polycystic ovarian syndrome, which is the PCOS, affects estimated about 8 to 13% of reproductive age group women, with up to 70% being undiagnosed worldwide. Now, that is a mammoth number. If we have females who have PCOS, especially in the reproductive age group, which is the most productive age groups, wherein our life is dependent on a lot of things related to reproduction, and out of these 70% are sometimes not detected, either due to the unawareness of the patients or due to not thinking about this diagnosis by the doctor. So that is why we have selected this topic to go in depth and have in-depth knowledge how to detect it, what are the features, what should be done, what are the remedies. Researchers say polycystic ovary syndrome can create eightfold increase in suicide risk in people who have this condition. Now, you may be aware that this condition, which is the PCOS, is also associated with obesity and weight related issues. These people have reproduction related issues, they have issues related to periods, they have issues related to their eating, they have issues related to the insulin resistance which is present in the body, which can also lead to depression, especially such features being present in such a young age. So that is why these people, they develop depression and then they become very prone to having suicide. People with PCOS may score lower on the cognitive test than people without this condition. This has been proved in research. यानी कि ये देखा गया है जिन लोगों को PCOS होती है उनके IQ लेवल्स कम हो सकते हैं। वो इंटेलिजेंस के साथ नहीं सोच पाते क्योंकि बहुत सारे फैक्टर्स होते हैं कॉग्निशन को इंक्रीज करने में। यदि आपकी फिजिकल हेल्थ अच्छी नहीं है तो जाहिर सी बात है मेंटल लेवल पे आपकी जो अलर्टनेस है वो कम हो जाती है। सो ये देखा गया है रिसर्च में कि इसका अलर्टनेस से या कॉग्निटिव फंक्शन से जो हमें दिमाग की जो इस्तेमाल करना होता है हायर फंक्शंस का, कॉम्प्लिकेटेड प्रॉब्लम्स को सॉल्व करने में, जिन्हें PCOS होती है, उनमें कम इस्तेमाल होता है एज कंपेयर टू दोज जिनमें ये कंडीशन नहीं होती। Dietitian recommends dairy-free approach for PCOS management, citing multiple benefits. यानी कि PCOS के साथ ये देखा गया है कि डायरी के जो प्रोडक्ट्स होते हैं, जो मिल्क और मिल्क बेस्ड प्रोडक्ट होते हैं, इन चीज़ों को अवॉइड करना चाहिए और ऐसा देखा गया है कि इससे फायदा ज़रूर होता है। Expert approved yoga asanas are there to help and manage PCOS. And this is very true because I have myself seen the benefits of yoga, how it helps your daily life, because you undergo those exercises which are able to take care of your weight as well as your stretching and your muscle strength. So it does help in every of the medical related conditions. Now let's go to the topic of the day. आज हम डिस्कस करने वाले हैं टॉपिक विच इज कॉल्ड PCOS, विच मीन्स पॉलिसिस्टिक ओवेरियन syndrome, जिसमें हम उसका management discuss करेंगे. We'll be discussing about the management of PCOS, and I'm very delighted to introduce my guest here, Dr. C. Sharath Kumar.
Namaste. Good evening.
Namaste. Good
Hello,
evening
Vini.
and
How are
namaste.
you?
I'm good, sir.
Nice
How
to
are
see you
you?
on this platform. Probably the
Same here.
largest platform of the doctors directly communicating with the clients. I'm so
Yes,
happy
sir.
to be here. So, and also I sincerely thank you people for inviting me to this platform.
Thank you
I'm
so
delighted.
much, sir. सर को मैं जितना भी उनकी तारीफ करूं वो कम होगा, लेकिन आपको बता दूं कि डॉक्टर शरद सी कुमार कौन है. डॉक्टर सी शरद कुमार holds the esteemed positions of principal professor and head of the department of the reproductive medicine and surgery at the renowned Medivave Institute of Medical Sciences in Mysuru. With an exceptional education background and a remarkable track record, he has garnered immense success through his career, driven by his passion for mentoring. He has guided numerous students and played a pivotal role in elevating the institute to unprecedented heights of accomplishment. His dedication and expertise continue to inspire and shape the future of medical education and research in the field of reproductive medicine and surgery. Very warm welcome to you, sir, and we are very
Thank
delighted
you
to
so
have you
much.
here.
Thank you, Vinay, for such a nice introduction. I didn't know about myself. Thank you so much. You have highlight and whatever little I had. Thank you so much. And without wasting any of our time today, straight away we would like to go to the management of
Yes,
PCOS.
sir.
Because
Yes, sir.
Vinny has already covered half of it. I don't know what else is left over. So still, we'll do whatever justice we can do for today's subject.
Right,
And
sir.
many people mistake PCOD and PCOS. Let me clarify. PCOD is a diagnosis given by the ultrasonologist, stating that it is polycystic ovarian disease, that there are multiple follicles in the ovary. That is the diagnosis given by the sonologist. PCOS is a syndrome. It contains so many aspects. There are five aspects of the disorder. That is, one is irregular periods. That is, the menstrual cycle stretches more than 35 days, 40 days, sometimes even 2 months also. That is one thing. Secondly, excess androgens will be there. Third thing is excess androgen will result in male type of baldness and hirsutism, acne vulgaris. And third thing is the polycystic disease. That is when the lady undergoes scanning, the sonologist will report it as multiple follicles seen all around the ovary in a pearl-like manner, usually more than 10 to 12 in each ovary. That is small cyst measuring even say 3 or 4 or 5 mm only. And fourth, the part of the syndrome is she may land up in infertility, as Vinny already told. And fifth one is obesity. That is, she will start putting on weight. So the management depends upon why she has come. Of all these five problems she is facing, which problem is worrying her? Has she come for infertility? Has she come for the obesity? Has she come for acne? Has she come for irregular periods? So the management depends upon the why she has walked into the gynecologist room. So if she has come for infertility, the management is entirely different. We'll be starting her straight away with the ovarian stimulants like clomiphene citrate, letrozole, that is a selective medicines which will stimulate the ovaries and produce the follicles, and ovulation will occur. And we may start even with gonadotropins. And if she has got multiple follicles and she is in a very stage where she is desperate to become pregnant, we may even do the drilling of the ovaries to remove the excess follicles. So aggressive treatment of all these things can be done. And gonadotropins, adding FSH, LH, HCG to the treatment, HMG to the treatment. So we become aggressive if she has come for a specific relief from the gynecologist. That is, if she has come for infertility. Of course, not to forget about the lifestyle management. As Vinny already told, the most first and most important treatment in any PCOS is the lifestyle modification, which includes diet, exercise, yoga, meditation, because most of these people would have added down extra weight. Even losing 5% of our weight will give so much relief, and even the cycles may become regular. And the dose of medicines we give, all the medicines depends upon the weight, that is per kg body weight. So if she loses say about 10 kg body weight, the dose which we give will come down drastically by 20-30%. So she'll be saving money. Instead of 150 units of FSH, even 75 units of FSH is enough. Instead of 50 mg clomiphene, 25 mg may be enough. Letrozole 2.5 mg may be enough if she reduces the weight. So lifestyle modifications where stop smoking. Of course, in India, the smokers are very less girls, but still we have to tell them, if she is smoking, stop smoking. If she is have got any alcoholic tendency, reduce the alcohol or stop alcohol. And exercise, regular exercise, especially walking, jogging, cycling, swimming, any type of exercise, gardening, or anything she can pick up and do regularly. That is very, very important. Minimum 10,000 steps per day is very, very important. This will lose her weight, as well as the hormones will be balanced, and she will start getting the cycles also regularized. And yoga, which especially yogic asanas, which concentrate upon the pelvic floor muscles. Squeezing the pelvic floor muscles increases the blood supply to the ovaries, and thereby the cycles may become regular. So, lifestyle modifications and reducing the junk diet, junk food, and reducing carbohydrates, increasing the proteins, and increasing the fibers. This is very, very important. That will add a lot of things to this one. And if she is unable to lose weight by these methods, she can start taking some statins or some drugs wherein early stat, where the absorption of the fat is prevented, and the fat is removed from the body without getting absorbed, and she may lose the weight. And last thing is the removal of the excess fat if there is morbid obesity. So weight management by diet, exercise, medicines, and surgery is the first line of management. The second line is the regularization of the periods. If she has not come for infertility treatment, if she has come for just management of the PCOS, regularizing the periods is very, very important. And regularizing, the best method is oral contraceptive pills. With
I
combined,
think we have
yeah,
some connection issues here. Yeah, we are here
yeah,
able to hear you, sir. Yeah,
yeah.
please go ahead.
The battery is going low. If it goes out, then immediately will switch over to the mobile phone. So
Yes, please.
that will take 1 minute time. So I'll be ready. So the second thing is the oral contraceptive pills, low dose estrogen and progesterones. The many brands are available: Diane, Levanoma, even Mala D, which is easily available by government supply. Even it is available in the Pradhan Mantri drugstores, which is almost available free of cost. And she can even go to the any these centers, family planning centers, and get these medicines free of cost also. So minimum 6 cycles of oral contraceptive pills will regularize the periods. And next one is the after regularization, excess androgens. If there is excess androgens, it can be treated with spironolactone tablets or DHEA. These can be given to remove this one. That will reduce the acne, that will reduce the hair loss, and also unwanted hairs, that is hirsutism. Male type of distribution of the hairs can be controlled by these medications: DHEA, spironolactone, and vitamin D. And the fourth one is the polycystic disease. That is when the sonologist says the ovaries are both enlarged and multiple follicles are seen, plenty in number. Then removing them by the drilling, that is laparoscopic ovarian drilling, will help a lot if the condition is severe. That is, if it is not manageable with medical line, with the line of this one, that is the uh, OCPs, oral contraceptive pills. If these things they cannot help, then the last thing will be the drilling. Drilling should be taken in the end, not in the beginning. And after these things, then the next one is Other medicines which are in the line of treatments are plenty of medicines are available. Some of them are just I will tell you. Metformin. Metformin is a wonderful drug. It has guides and for insulin resistant cases. The metformin is the drug of choice, and also if PCOS is accompanied by diabetes, type 2 diabetes, metformin is the drug of choice. Metformin reduces the insulin level, and also it reduces the body weight also, because the body metabolic rate is increased by the using the metformin. Dose will be something like 500 milligrams starting dose, can be increased up to 3 grams also, that is 2 tablets 3 times a day in morbid obesity cases. In mild to moderate obesity, 1 gram is more than enough. So metformin is the drug of choice for the PCOS patients. And also if she has come for the treatment of infertility, again metformin plays a very important role by inducing the ovulation also. Next line of tablet available is inositol. Inositol is also tried, and also it acts similarly to metformin. So spironolactone, inositol, metformin, DHEA, all these drugs act in a similar way. They change the metabolism so that the fat is converted into glucose, and thereby the fat level is decreased, obesity is decreased, and ovulation is induced. The next lines are the statins, atorvastatins and orlistat, medroxyprogesterone, vitamin D. They are the latest medications available for the treatment of the management of the PCOS. How orlistat acts? It stops the absorption of the fat in the GI tract. Thereby, whatever excess fat the lady is eating, it gets unabsorbed in the GI tract, and it is expelled through the rectum. So, orlistat is a very good drug. And medroxyprogesterone acetate, after starting the OCP and going for 3 to 6 cycles of OCP, only progestin only tablet can be changed, so that estrogen can be avoided, and the treatment method can be changed by adding medroxyprogesterone acetate. The bleeding is controlled, excess bleeding, especially some PCOS ladies will have 5 to 7 days bleeding. Some heavy clots will also be coming, though they have the periods once in 3 months. The bleeding continues for 7 to 10 days also. See, medroxyprogesterone acetate helps. And coming to the other medicines like vitamin D, vitamin C, E, and other things, and also L-arginine, L-carnitine, these have been tried, but they act only as adjuvants, and they are not the mainstream of treatment. They have to be taken with a pinch of salt only. So spending heavily on these things may not help, because people, especially pharmaceutical companies, dump with so many medicines on the list. Just because they have one small bit of evidence, they try to market it. These are all very costly, this one, especially L-arginine, L-carnitine. Each sachet costs about, say, 100 to 150 rupees, and 30 sachets means 4.5 to 5,000 rupees they have to spend on these adjuvants. So be careful to spend other than the ones which are totally recommended and also proved drugs. So whatever the medicines have told are Cochrane reviewed, proved drugs, and they can be safely taken. And coming to the side effect of these medicines compared to the amount of benefit the lady gets, the side effects are negligible. One need not worry about it. And taking 3 to 6 cycles of clomiphene citrate or letrozole, it won't harm the lady in any way. They are quite safe. Even metformin has been proved to be safe. They can be taken very safely. So, friends, the management depends upon why the lady has come, and if it is for acne, the treatment is entirely different. If she has come for the obesity, treatment is entirely different. Of course, basically we'll be treating the PCOS, but the line of treatment will be more aggressive, depending upon the this one. For example, if she has come with severe obesity, type 2 diabetes, then the treating the obesity and PCOS, the obesity and diabetes is the prime important than the PCOS. So we have to aggressively treat them first, those things, then come back to the PCOS. And of course, the last thing is the drilling, ovarian drilling. Ovarian drilling has to be kept as a last resort, especially if she has come for the management of infertility. So these are the things. I'll be changing over to the this one, my mobile. Just give me 1 minute.
Yes, sir. So till
Yeah.
sir is changing their device from the laptop to their mobile, we'll talk about what sir has spoken
Yes,
in
you can
summary.
keep talking. You can keep
Yes.
talking. Yeah.
So we spoke about PCOS and PCOD. हमने आज जाना कि PCOD क्या होता है और PCOS में क्या फ़र्क होता है। यानी PCOD जो होता है वो पॉलीसिस्टिक ओवेरियन डिजीज़ एक अल्ट्रासाउंड डायग्नोसिस है। जब आपके रेडियोलॉजिस्ट या सोनोलॉजिस्ट आपको बताते हैं कि आपकी ओवरी में सिस्ट है तो उसे PCOD कहा जाता है। और यदि ये कोई सिंड्रोम प्रोड्यूस करता है बॉडी में, यानी कि एक ग्रुप ऑफ सिम्पटम्स बॉडी में क्रिएट करता है, उसे PCOS कहा जाता है। सो PCOS क्या-क्या कर सकता है? जैसे सर ने अभी बहुत ही अच्छे तरीके से बताया कि बहुत सारी चीज़ें इसके साथ एसोसिएटेड होती है, डायबिटीज़, ओवरवेट, ओबेसिटी, इंसुलिन रेजिस्टेंस या फिर आपका एब्डोमिनल ओबेसिटी, OSA के केसेस बहुत कॉमनली होते हैं, इनफर्टिलिटी होती है, पीरियड में इरेगुलरिटीज़ होने लगती हैं, आप वेट पुट ऑन करने लगते हैं और या फिर पेट में कई बार दर्द भी रहने लगता है। आपके पीरियड्स जब इरेगुलर होते हैं या प्रोलॉन्ग्ड होते हैं तो उससे काफ़ी दिक्कत होती है और इसका मैनेजमेंट जिसके बारे में हम आज बात कर रहे हैं वो डिपेंड करता है कि किस वजह से लेडी आपके पास आ रही है। क्या उन्हें इनफर्टिलिटी की दिक्कत है या ओबेसिटी से ज़्यादा प्रॉब्लम है या डायबिटीज़ उन्हें तंग कर रहा है। तो उनसे एक डिटेल्ड डिस्कशन करना और एक कंसेंसस बनाना डॉक्टर और पेशेंट के बीच में बहुत ही अनिवार्य होता है। आप अपने पेशेंट से डिस्कस करें कि कौन-सा सिम्पटम उन्हें ज़्यादा तंग कर रहा है और हमारा हालाँकि मकसद होता है कि हर सिम्पटम को हम ट्रीट करें, लेकिन जिस सिम्पटम के साथ वो आए हैं, उसको ज़्यादा तवज्जो देना या ज़्यादा अटेंशन देना हमारा फ़र्ज़ बनता है। इसी के बारे में हमने बात की, कितने मेडिसिन्स इसके बारे में यूज़ होते हैं। मैं सर से क्वेश्चंस करना चाहूँगी। आई वुड लाइक
Yeah,
टू
yeah.
टेक अप
Please.
सर्टेन
Can you
क्वेश्चंस
hear
विद यू
me?
सर।
Vinny, can you
Yes,
hear
sir,
me?
very clearly.
Yeah,
Yeah.
yeah. Please. Yeah.
So we were talking about OCPs in the use of PCOD
Yes.
when a lady has irregular periods. So Noor Aga Danish is connected with us. He wants to ask how long one should take OCPs for irregular menses and when the OCP stops, the
Yeah.
irregularity
See.
might start again.
Yeah.
So what should be
See.
done?
Yeah. See, PCOS is a long-term disorder. PCOS. It cannot be cured. It can be controlled only. So OCPs we give just to regularize the periods. That is not the end of the treatment. The main treatment is lifestyle modification, diet, exercise, reduce the weight, and reduce the other whatever the aggravating factors like alcohol or smoking and junk food. All these things should be controlled. Till you control all those things, we would have given the OCPs so that you start getting the ovulations regularly and start try to conceive at an early date. So that is not the treatment, final treatment. The final treatment is the, of course, ovarian delay. So 3 to 6 cycles of OCPs, the cycles get regularized, and afterwards you can stop and watch. If the cycles continue to be regular, then you are happy. You have controlled the disorder to some extent. Of course, after 3 6 months, again the cycles may become irregular. But usually, a 6 cycle OCP is the standard treatment, and with 1 cycle only, if you stop, you may not get any result. Minimum 6 cycles are required. But added to that, other lifestyle modifications have to be done.
राइट सर। सो दिस इज वेरी वेल एडवोकेटेड। ऐसा अक्सर हमने देखा है कि पेशेंट्स कहते हैं दवा खाने से हम ठीक हो जाएं, यदि दवा खा रहे हैं तो हमें लाइफस्टाइल मॉडिफिकेशन की ज़रूरत नहीं है। जी नहीं, ऐसा बिल्कुल भी नहीं है। दवा जो है वो सपोर्ट करता है आपके अपने एफर्ट्स को। यदि आप
yes,
एफर्ट नहीं करेंगे वेट लॉस का या लाइफस्टाइल मैनेजमेंट का, तो दवा पूरे तरीके से काम नहीं करेगी, क्योंकि किसी भी दवा की मेडिकल साइंस में एफिकेसी 100% नहीं हो सकती। सो
yes,
ज़रूर
very
ध्यान रखें, जो सारे एडवाइसेस आपके डॉक्टर आपको दे रहे हैं उन्हें ज़रूर फॉलो करें। और लाइफस्टाइल मॉडिफिकेशन जो है, हमारे जितनी भी मेटाबॉलिक डिजीजेस रिलेटेड हैं या लाइफस्टाइल से रिलेटेड डिजीजेस हैं, उसमें लाइफस्टाइल मॉडिफिकेशन एक प्राइम इंपॉर्टेंस होती है। यदि आप ये नहीं करेंगे तो दवा का फायदा आपको नहीं मिलेगा।
yes, yes. And also
वी हैव
psychological factors.
यस
See, this PCOS is a multifactorial disorder. It is psychological as well as dietary, as well as hormonal, and also genetic factors are also involved. So, the psychological factors can be controlled only by yoga, meditation, changing their lifestyle, listening to the music, joining a dance class, and changing whatever, stopping the gossip, stopping the seeing all sorts of serials, getting bugged with those serials. Change the lifestyle so that your mind will be calm, quiet, a good sleep, and the exercise will help a lot. So psychological factors have to be tackled only with listening to nice music and also with meditation.
Yes, sir. Very well said.
Yeah,
So we have been talking about progesterones, or
yeah,
what we call as medroxyprogesterone
yes,
acetate, which
yeah,
is very well prescribed in a condition like PCOS. So
yes,
we have all heard about the hormones which can cause certain side effects, which can be hypercoagulability of the
yeah,
blood. So
yeah.
are there any major side effect, and how to keep a track of them? What should be the screening factors which we should be able to see in a patient?
Yeah, very good question. As far as these the medroxyprogesterone or whatever OCP we use are quite low dose, and the side effects are not reported so many, but still, if there is excess bleeding disorders, and if there is blood dyskaryosis, if there is leukemia, or if any other blood disorder, you have to consult a hematologist or a physician and then get the treatment done perfectly for those hemolytic disorders, and then take these medicines. Any medicine for that matter, if a lady has got some blood dyskaryosis, definitely she will have a lot of bleeding problem, not because of the medicines, that is because of her inherent the medical condition, that is the blood disease. Maybe bleeding time may be more, clotting time may be very less, the blood may not clot at all. So all these things have to be kept in mind, and regular blood checkup, regular blood count, and bleeding time, clotting time, and complete hemogram is very important. At least once in a year, if not more frequently. And chances of cancer are very rare. One need not worry about the dose which we use in these conditions.
Right, sir. Very well said. So Noor Agha ji has another question, which I
Yeah,
was also asking about, which is hypercoagulability after and during the use of OCPs. So if somebody has a tendency, or they have a genetic history of deep venous thrombosis, so
yeah.
are these the right candidates to, can we prescribe OCPs in these patients, or are there any factors, or do we have to screen these patients before prescribing OCPs, like protein C and protein S, where we have hypercoagulability seen in cases of patients who have genetic causes of deep venous thrombosis and pulmonary embolism. So,
Yeah, this, yeah,
so
please go
about
ahead.
those patients, how do
Yeah.
we screen them?
Yeah, if the risk is severe, then better we avoid the OCPs. Go only for short-term progestins or change over to gonadotropins, that is FSH, and avoid these medicines, long-term medicines. And the best thing will be something like a locally acting estrogen, that is Merina, that is inserted into the uterus, since it will be acting locally only, changing the endometrial pattern, inserting the Merina. The chances of these coagulations with blood clotting, with deep venous thrombosis can be reduced to some extent. And of course, the ideal will be drilling, ovarian drilling. So go to the root cause itself and get rid of the multiple cysts rather than trying these medicines. Once you know that there are chances of deep vein thrombosis and blood clots and so many complications of blood clot, that is including the stroke or brain stroke or heart stroke. So best thing is avoid the medications, change over to the non-medical treatment, that is lifestyle modifications and weight reduction and ovarian drilling. And of course, the hormone coated intrauterine devices, where it will be acting locally. It will not enter into the main bloodstream in a bigger way. That will be better.
Right, sir. Very well said. So, are these IUDs insertion painful? Does a patient need to be getting admitted?
Absolutely no. Absolutely. If they are inserted by the expert hand, they are almost painless. And the only worry with this intrauterine contraceptive device coated with hormones is they may get misplaced easily. One has to be careful, especially if there is patulous cervix, where multigravida lady who has the patulous cervix. If you insert the marina, it may drop out because it may not remain in the uterus. Such
Uterus.
problem will not occur in PCOS conditions, because after all the lady has come for infertility or subfertility. She may not have conceived so many times, and a lady with the patulous cervix has already delivered so many means PCOS is ruled out. So the only complication of PCOS is misplacement, displacement, and falling out. That is the only thing. And very few ladies, they have get cramps, that is uterine cramps, because of the foreign body inserted into the uterus. Such cases, if the cramps are too much, about 2 or 3 cycles, she may take some analgesics, anti-cramp medicines, antispasmodics. Usually within 2 3 months she gets adjusted to that marina. And if she doesn't get adjusted even after 2 or 3 cycles, if it is so much worrying, then it may have to be removed for medical reasons. Otherwise, the acceptance is quite good, and it removes all the possibilities of the side effects of so many medicines, and it can be safely used.
Right, sir. So, we spoke
And
about
skin patches also. Yeah,
right, sir. So we spoke about ovarian drilling, which means that cysts
yeah,
have to be burst inside the ovary so that they
yeah,
give the good follicle space to develop and release the
yeah,
egg.
yeah,
So Nandlal Sharda ji is connected with us. He's a doctor himself, and he's
yeah.
asking something regarding grinding stones. Now, I don't understand grinding stones. How does that help in case of these ovarian polycystic kidneys? So, is there any relationship between the two? Or the second part of the question is that how do we do this ovarian drilling? Is it a laparoscopic procedure? Is it an open procedure? And is it under anesthesia? How is it done?
Yeah, very good question. Regarding the grinding stone is concerned, I am not sure what exactly he means. I'll refer it and I'll answer it through email to the IGCP, so that
Right,
the
sir.
answer can be passed on to them. Right now, I have no idea about it. Regarding the method of ovarian drilling, several methods are available. Open surgery is not so much indicated nowadays, because hardly anybody opens the lower abdomen to drill the ovaries. It is not indicated because of the complications of open surgery. So many additions can occur. The surgery itself will have a lot of complications. The best one is laparoscopic ovarian drilling by 2 holes or 3 keyholes. Easily it can be done. It's only a matter of few minutes, and it can be done under general anesthesia as well as spinal anesthesia, depending upon the choice of the lady. And rarely it can be done under local anesthesia also, but we don't advise this thing to be done under local anesthesia, because at any time the lady may get pain during the surgery, and it may create a lot of problems. So the ideal is general anesthesia. Of course, short general anesthesia is enough, because it hardly takes much time for the surgery. With an expert hand, it takes only about 10 12 minutes. And of course, with new hands, the surgeon can take 20 30 minutes. So general anesthesia is ideal. Of course, if the lady wants, spinal also can be done under spinal anesthesia also. So laparoscopic ovarian drilling is the ideal one. The open surgery is not indicated because of various reasons, including cosmetic reasons of damaging the lower abdomen, because most of the girls wants to wear low saris and show their belly and also the lower part of the abdomen. So that scar may create a problem to her. And even the partner who sees that scar, he may get some off from the sexual activity because he sees something wrong in her. So the best thing is the keyhole surgery.
राइट सर। सो सर बताना चाह रहे हैं कि की होल सर्जरी जिसको हम लेप्रोस्कोपिक सर्जरी भी कहते हैं, एक बहुत ही आसान सा तरीका है जो हम ड्रिलिंग करते हैं ओवरी की सिस्ट हटाने के लिए। बहुत ही एक आसान तरीका है, डे केयर प्रोसीजर होता है। इसमें हम स्पाइनल एनेस्थीसिया या जनरल एनेस्थीसिया के अंडर पेट में अंदर जाते हैं की होल्स के द्वारा। सो इन्हीं की
Yes,
होल्स के द्वारा कुछ इंस्ट्रूमेंट्स अंदर डाले जाते हैं
yes,
जिनसे
yes,
कि इन सिस्ट को जो है वो फोड़ा जाता है, यानी कि उनकी
yes,
ड्रिलिंग की जाती है। इसका फ़ायदा ये होता है कि अंडरलाइन जो ओवरी के जो गुड फॉलिकल्स होते हैं, उन्हें जगह मिल जाती है ग्रो करने के लिए और उनका अच्छा ओवम जो है वो रिलीज़ होने में मदद होती है। सो यही प्रोसीजर होता है, एक डे केयर प्रोसीजर है। हीलिंग में कोई प्रॉब्लम नहीं होती क्योंकि एक की होल के द्वारा हम अंदर जाते हैं, तो एक स्टिच का केवल ऑपरेशन होता है जिसमें अगले दिन या 48 घंटे के अंदर आप अपने काम पे
yes,
लौट सकते हैं। सो
yes.
Nandlal Shardaji has added his points on the grinding stone. He meant by the grinding stone good exercise for waist. The
Ah, yes,
grinding of
I thought of it, but since it came from a doctor's mouth, I was little worried answering that one because he might have picked up some new thing somewhere read in a recent this one. So grinding stone is the thing, but yes, very good, excellent. That is, do everything yourselves at home, right? From washing the cloths, grinding these grinds, everything. Start doing yourselves so that that will add a lot. Instead of sitting in front of the TV and watching multiple serials, right from all the Z or Sony, everything, and added to that, start eating some chips or French fry when watching the TV. It adds to the weight and also it strains your eyes, and also the mind is diverted because of seeing so many complex serials, and we start getting involved into the serial. That lady shouldn't have done like that, and in fact it will be discussed on the chats also. Say, did you hear what happened into that serial yesterday? Say that man shouldn't have been done like that. So these things I hear whenever I go to walking, the ladies chatting regarding the previous day's serial also. So the best thing, especially Anupama, is discussed in such depth that
length.
they should have become the directors, in fact. So the best thing is get involved in gardening, all doing all works yourselves at home. That is the best exercise you can get.
Right, sir. We have a lot of questions. I'll be taking them one by one. So we
Yeah,
have somebody who is connected to us. I won't be able to tell their name because they have
not
kept a
required.
mirror name. Yes. So
Yeah.
they're saying they're not having periods for 3 months, but also the pregnancy test report is negative. What should be done? And their age is 20.
Yeah, the first thing is they have to get one pelvic scanning done. Best thing is transvaginal ultrasound scanning of the uterus to know what has happened inside the uterus to rule out remote possibility of pregnancy. Of course, she says UPT is negative, but still, yes, scanning will be better. And second thing is, if she is already having PCOS, start the treatment for PCOS. Before starting the PCOS treatment, give 5 days progestin tablets, that is registrone tablet, 5 mg daily, three tablets daily for 5 days. Get the periods first, and after the periods, second day of the periods, get detailed analysis of the hormones and find out what hormonal imbalance she has got, and also from day 5 of the next cycle, give 3 or 6 cycles of OCPs to regularize the periods and then try for the pregnancy. And whatever other signs and symptoms I had told about the PCOS, if she has got any of those PCOS signs and symptoms, then lifestyle modification is a must.
Right, sir. सो द फर्स्ट मोडालिटी फॉर यू वुड बी अल्ट्रासाउंड। आपको जो पहले टेस्ट
Yeah,
कराना चाहिए वो अल्ट्रासाउंड
yeah,
है, क्योंकि यदि उसमें एक अनडिटेक्टेड प्रेगनेंसी है उसका
yeah,
भी डिटेक्शन होना पॉसिबल हो जाता है। और दूसरी तरफ जो पीसीओडी है
yeah,
यानी
that
कि
will.
जो सिस्ट फॉर्मेशन है वो भी अल्ट्रासाउंड के माध्यम से इजीली डिटेक्ट हो सकता है। सो आगे का ट्रीटमेंट इस पे डिपेंड करेगा कि आपके अल्ट्रासाउंड में क्या दिखता है। We have Vishali Sabhankar ji, who is asking about the other OCPs, other medications other than OCPs which may be available to guide for the treatment which can be used in PCOD. The second question is from Nouraga ji. He says, is Dian 35 a good OCP? Should it be prescribed?
Yeah, Diane 35 is a very good medicine, low dose estrogen and progestin, and that can be very safely taken. And any OCP which is available in the market, especially if it is a low dose, it is always good because we are going to give it for long time, maybe even 6 months or 1 year also. So low dose estrogen progesterone combination, Diane is a very good tablet, can be taken. But only thing is, it is slightly costlier. So cheaper variety of say something like Mala D, Mala N, they are easily available in the market. Depending upon the economic situation of the lady, she can go either for costly medicines or cheaper ones which are easily available in the market, or even the cheapest ones available in the Pradhan Mantri medical stores, or go for the OCPs available in the family welfare centers which are given free of cost.
Right, sir. I would request the audience, if they have any questions, they can type in the comment box and we will be taking your questions. So we have discussed about management of PCOS today, which is a very, very common condition wherein the incidence is also increasing in Indian public, which is keeping in pace with the other metabolic diseases, which
Yes.
is increasing. The milieu is increasing, including diabetes, hypertension, central obesity, obstructive sleep apnea. So all these diseases are lifestyle related diseases। यानी कि किस तरह आप जीवन अपना व्यतीत करते हैं, क्या खाते हैं, यू आर व्हाट यू ईट, किस तरीके से
Yes.
आप एक्सरसाइज को इम्पोर्टेंस देते हैं या सेडेंट्री लाइफस्टाइल जीते हैं, ये चीज़ें डिटेक्ट या बहुत ज़्यादा डिसाइड करती हैं कि क्या आपके अंदर बॉडी में चेंजेस होते हैं। सो सब रिसर्च से यही पता चला है कि सेडेंट्री अपने आप में ही सेडेंट्री होना एक बहुत ही खराब चीज़ है और इसको कंपेयर किया गया है स्मोकिंग से। सो स्मोकिंग से जिस तरह आपके बॉडी में इन्फ्लेमेशन बढ़ती है, सेडेंट्री लाइफस्टाइल के कारण भी आपकी बॉडी में एक ऐसा इन्फ्लेमेटरी मिल्यू तैयार होता है जिसके कारण आपकी बॉडी की सर्कुलेशन भी अफेक्ट होती है, चाहे वो हार्ट हो, किडनी हो, आपकी ओवरीज हो, आपका ब्रेन हो, या जितने भी इंपॉर्टेंट ब्लड वेसल्स है बॉडी में, उनकी ब्लड सप्लाई रुक जाती है और आपकी बॉडी को ओवरवर्क करना पड़ता है, क्योंकि बैठने के कारण वजन इतना बढ़ जाता है कि आपके लंग्स और हार्ट उस वजन को झेल नहीं पाते, उन्हें ओवरवर्क करना पड़ता है। यही कारण है बार बार हम हर एपिसोड में आपको बताते हैं कि सेडेंट्री लाइफस्टाइल जीना अच्छी बात नहीं है। किसी भी फॉर्म में एक्सरसाइज करना, यदि आप केवल 15 मिनट से 30 मिनट भी हर रोज करते हैं और विगरस एक्टिविटी, एक विगरस एक्सरसाइज करते हैं, तो वो काफी फायदेमंद होता है आप सबके लिए। इसके साथ ही एक बहुत अच्छा सवाल हमारे पास आया है डॉक्टर दीपक के तरफ से। डॉक्टर दीपक is trying to ask us regarding the treatment options which we can offer to PCOS patients in case of hirsutism.
Yeah. Hirsutism, the best tablet will be spironolactone tablets. They are anti-androgen tablets. Added to that one, DHEA can be added, and vitamin D can be added. These three medications can be added, and depilation of the excess hair which are already there, because whatever medicines we give, it will stop the further addition of the extra hairs. Already existing hairs cannot be removed by giving any medications. So, by changing the hormonal level inside, that is, by reducing the androgens and increasing the estrogen, it will not remove the excess hairs, that is, hirsutism, maybe over the chin or the back of the neck or on the chest. or on the excess on the legs and arms. So epilation or any method of removing the hair, consulting a dermatologist or a cosmetologist can be done. And further increase in the number of hairs growth can be controlled by these medications. And the baldness, that is male type of baldness, can be changed by minoxidil oil or by the hair transplantation if the male type of baldness has occurred, especially on the forehead. That also has to be consulted with a cosmetologist or a dermatologist or a trichologist who transplants the hairs. All those things can be done. So management of hirsutism is depends upon what exactly she wants, and whether she's worried about her face and the hairs on the legs and other things, and they can be easily removed by so many methods, including electrolysis or laser methods, or by epilation, or by even simple shaving also. But the only thing is, with shaving, the shaving cuts the hairs, and eating again it grows. Whereas epilation or other techniques of removing from the root of the hair, chances of regrowth are less. By that time, our medications should have started working, and further increasing newer growth of hairs can be prevented by medications.
Right, sir. That was a very good explanation regarding the management of hirsutism in cases of PCOS. एक्सेस जो बाल हैं जो अनयूजुअल एरियाज पे फीमेल्स में ग्रो कर सकते हैं पीसीओएस में, जैसे चिन एरिया में, बियर्ड एरिया में, एंटीरियर चेस्ट पे, एंटीरियर एब्डोमेन पे, इनसाइड ऑफ द थाइज में, वो काफ़ी अफेक्ट करते हैं और साइकोलॉजिकली भी काफ़ी आपके लिए
Yes,
लो मूड का कारण हो सकते हैं. सो घबराएं नहीं. पहले इसके जो ट्रीटमेंट्स थे वो काफ़ी कॉम्प्लिकेटेड थे. इलेक्ट्रोलिसिस एक ट्रीटमेंट परमानेंट हेयर रिमूवल का था, लेकिन एक बहुत ही टीडियस प्रोसेस होता है जिसके कारण स्कारिंग के चांसेस कभी कभी रहने के
yes,
होते हैं, क्योंकि इलेक्ट्रिक करंट से हेयर के रूट को एक एक करके मारा जाता है. तो आप ध्यान लगा सकते हैं कि कितना टीडियस प्रोसेस होता है एक एक हेयर को इलेक्ट्रिक करंट से मारना. वहीं दूसरी तरफ आजकल लेजर हेयर रिमूवल का चलन है, जो बहुत ही आसान तरीका है
yes,
एक
easy.
एक एक बड़े हेयर के एरिया को कवर करने में बहुत ही सक्षम रहता है और इससे कोई पेन भी नहीं होता. एक लाइट रेज की एमिशन के द्वारा रूट, जो आपका हेयर का रूट होता है, उसे मारा जाता है और इसके रिजल्ट्स भी काफ़ी अच्छे होते हैं. सो पहले ये ट्रीटमेंट काफ़ी
Yes,
महंगा हुआ करता था. अभी आजकल काफ़ी सेंटर्स खुल गए हैं, काफ़ी अवेलेबिलिटी हो गई है इस ट्रीटमेंट की, तो बहुत ज़्यादा महंगा नहीं है. इसको इंस्टॉलमेंट्स में आप अफोर्ड कर सकते हैं.
yes,
सो अपने दिमाग के ऊपर इतना बोझ ना डालें, क्योंकि जैसे मैंने कहा कि ये एज बहुत प्रोडक्टिव होती है और दूसरी तरफ आपका ब्रेन इस प्रेशर में भी रहता है कि किस तरीके से आप सुंदर दिखें और सबसे अपने कॉम्प्लीमेंट्स ले. सो ये चीज़ आपके ब्रेन को इस एज में काफ़ी अफेक्ट करती है कि हर्स्यूटिज्म क्यों नहीं जा रहा. सो घबराएं नहीं. काफ़ी ज़्यादा ट्रीटमेंट्स अवेलेबल हैं जिसकी आप मदद ले सकते हैं, जैसे हमें सर ने बताया. मुकेश मक्खलिया जी हमारे साथ हैं. ही इज आस्किंग, सर कैन वी कंटिन्यू मेटफॉर्मिन इफ पीसीओएस women becomes pregnant in all the three trimesters and
yeah,
associated with the diabetic state?
yes, yes. So it can be continued even after delivery also.
Right, sir.
It
It
can be
has
continued
been
not only before pregnancy, during pregnancy, all the three stages of pregnancy, first trimester, second trimester, third trimester, and also in the postnatal period also she can continue. It is very safe, and absolutely it won't affect the fetus, and also it won't affect the newborn baby also. It is quite safe. It has been proved by
right.
several studies. Yeah.
सो वी हैव मेनी स्टडीज नाउ जिसके द्वारा प्रूव किया गया है कि
Yeah.
मेटफॉर्मिन, जो कि डायबिटीज की ट्रीटमेंट होती है और पीसीओएस की भी ट्रीटमेंट होती है, वो प्रेगनेंसी
Yes.
के अंदर भी सेफ होती है और प्रेगनेंसी के दौरान या प्रेग्नेंट होने से पहले भी इसे कंटिन्यू किया जा सकता
Yes.
है. Shreya is asking us a question. Good evening, sir. My age is 20. Why haven't I got my periods in 2 months? But I'm not pregnant. I'm sure for that.
Yeah. Uh, See this.
menstrual cycles are quite irregular, especially in young girls, say up to the age of 18 to 25, because the hormones are not well balanced during that. And there may be several causes for irregular periods, like stress, or going for an examination, or athletes going for runnings, or taking part in any of these sports activities. Androgens will increase, and suddenly the lady will not get the periods. So, and if she has put on the weight, if she has changed her lifestyle, and if she has changed from the regular life to sedentary life, all these things add to the androgens and absence of the menstrual cycle. So, changing the lifestyle and to get the periods by taking registrone tablets, that is progestin only tablets for 5 days, get the periods. Then, after the periods, if the cycles continue to be regular, then assess yourselves for a hidden PCOS. And if there is PCOS, get treatment for the PCOS by taking 3 to 6 cycles of Diana 35 or any other OCP for 3 to 6 cycles. And the most important thing is a pelvic scanning. Without pelvic scanning, we cannot finally say what exactly has happened inside. There may be a cyst, ovarian cyst, which is preventing the menstrual cycle. So, if the cyst is quite big, it may have to be drained by needle aspiration. So, the ideal thing is after pregnancy test, if it turns negative, then wait for another 1 week. If you don't get the periods in another 1 week, then go for a scanning. Transvaginal
Right.
ultrasound scanning is the ideal one. Abdominal
Right.
scanning is not that useful because we can't study the ovaries in detail with abdominal scan. So never hesitate to get a TVS done, because some ladies, some girls, they hesitate to get transvaginal scanning, stating that no, no, I don't want something to be inserted into the vagina, that this blah blah. No, what happens is abdominal scanning hardly gives us any information. Hardly we can see the ovaries, hardly we see the uterus. So what studies we can do with endothelium tissue, endometrium, and also small tiny follicles. Follicles will be 2 to 3 so it is not that easy to pick up the scanning where the ovaries and uterus with the abdominal scan. Because what happens in abdominal scan is they will ask you to drink a lot of water. The bladder blows up so much, hard the uterus and ovaries will be pushed to one end of the pelvis, and sonologist tries very hard to see, and finally he just gives a small report stating uterus is normal, ovaries are normal. But when you go to TVS, you will find these pearls which are all around the ovaries, and they can be picked up only by TVS. So leave your hesitation, get a TVS. If you are so worried about getting TVS, go to a lady sonologist. If you are very much concerned with a male sonologist, find out who is a female sonologist in your area if you are so much worried about your privacy. But still, I always recommend TVS.
Right, sir. And the other advantage of TVS is that the abdominal
Yeah,
gases don't obscure your organs. So
yeah,
बहुत
yeah, yeah,
सारे
yeah, yeah,
gases
yeah,
होते हैं हमारे
yeah.
गट में जो कि obscure
Yes,
कर
yes.
सकते हैं ovaries
Very,
को.
very true, very true.
So
Yeah.
TVS यानी ट्रांस वेजाइनल अल्ट्रासाउंड में
Directly we
क्लियरली
go
दिख
near the
जाता है.
ovaries. Yeah.
जी. Thank you so much, sir, for
Yeah.
today's session. It was a very, very
Thank you.
enlightening session, even for us females, because the problems of periods or
Yeah.
anything related to reproductive organs is very, very common in every female, which we are all aware of. So, thank you so much for enlightening us today. I would request Batul, my colleague here, to show you small token of appreciation, this certificate of attendance today here with us and spending your precious time with us.
Thank you. Thank you, Vinny.
Thank
Thank
you,
you so
sir.
much. I sincerely thank IJCP authorities. They contact me so many times. They take all their efforts to contact us, keep reminding. Even morning I got the call, sir, you have got this session, even 1 hour before I got. So really they are doing very hard work, sincere work to see that the professionals are brought into this platform. And we share so much of our knowledge, and we gain by distributing the knowledge. It is just like light. When we light a lamp, and the additional lamps will give more light to us, and the questions we get from the audience, learned audience, especially the doctors and even the learned patients, is so impressive. We start thinking ourselves and we start studying more and more to come to this platform and we share the knowledge. Thank you very much. Shubharatri. Good night.
Thank you, sir. Shubh Ratri and Jai Hind.